Telemedicine allows us to provide many solutions to problems. One solution is that we can close the distance gap for patients who are outside of our normal service area, but those distance gaps can be nearby.
An infant with suspected heart disease born in a rural community hospital can be many miles away from the nearest pediatric cardiologist.
Telemedicine has changed our practices in several ways. Before we had telemedicine, someone would have to drive out to the hospital, do the echocardiogram, and do a consult. And we still do that occasionally, but more often the telemedicine interaction can take care of all of that. We are able to provide more efficient care and better care to the patients at the referring hospitals. And it also saves money because some babies aren't transferred that otherwise would be. In the first 3 years of the program, we've done over 650 telemedicine studies, transferred over 30 babies for life-saving heart surgery, and probably prevented over 50 unnecessary transports. We estimated it saves us about 4 person-hours a week since we've had telemedicine. It may not sound like much, but in our billing scheme, 4 person-hours a week probably corresponds to several $1,000s of additional revenue we can get from doing something else. And that's resulted in probably an average increase per year in revenue to our practice of about $1 million, both from the echocardiograms and from downstream revenue of patients being transferred to us for surgery. And that's just for one workstation. If we had had multiple workstations, and we hope to in the future, the number could exceed several $1 million over a yearly basis, and that's just from time savings alone.
The MedVisor Tele-Echocardiograph solution was designed in collaboration with practicing cardiologists and includes features that support clinical practice requirements.
VitalNet has been very responsive in being able to adapt their technology to the specific needs of each individual physician and physician's subspecialty group. The needs that I saw for pediatric cardiology within telemedicine were to have a system that both could do real-time video conferencing and allow both store and forward, and what I like to call forward and store.
VitalNet's philosophy reflects a strong commitment to develop clinical solutions in close association with the medical experts who use these products.
The system is very user-friendly. The drop-down menus make the reporting process incredibly efficient. But if a different cardiologist wanted to do it a little differently, they could be changed. In most adult cardiology telemedicine practices, the store and forward model, where a study is obtained in a series of short digital loops and then forwarded over a telemedicine system for later review, works very nicely.
An integral component in this solution is the MedVisor Postmaster Server, which receives the patient data, updates the central database, routes the information to the appropriate clinician, and sends an alert that data is waiting for review.
Above and beyond that, there's also a reporting system which we have worked together to include all of the complex diagnoses that exist in pediatric cardiology. We also have many demographic variables that are unique to babies that are a very critical part of the report. When the study is completed, I relay the results to the physician both in a live video conference and by written communication through the fax or email.
VitalNet's Division Toolbox and the MedVisor engine allow the MedVisor's Tele-Echocardiograph product to be easily tailored to meet customer-specific clinical workflow and documentation needs.
So the combination of the reporting system, the live interaction, and having the video once the study's done really makes the system complete.
VitalNet is a total enterprise telemedicine solution provider.
We are actively using this in telecardiology, teleradiology, and in neonatology. And we're expanding our efforts now to include emergency medicine, primary care medicine, such as providing access to consultations with specialists, and we've been using it for some time in distance learning.
VitalNet offers a suite of scalable, customizable internet and wireless-based solutions that are cross-platform applications ranging from PACS to Pocket PC. Products include a home monitoring solution, This solution provides a user-friendly interface and wireless capability to easily capture and send patient data from the home. It also offers physicians the ability to access patient data and DICOM images from the field by using a wireless PDA or laptop.